My name is Paul Cambio. I'm one of the co-chairs of the California Lawyers Association Health and Wellness Committee. We try to put on interesting presentations for our members to help them become healthy, wealthy, and wise. Today, we're lucky enough to have Roger Royse with us. Roger Royse is a startup lawyer in Silicon Valley and a pancreatic cancer patient. Roger was diagnosed with stage 2B pancreatic adenocarcinoma in July of 2022 after taking a multi-cancer early detection blood test. After 6 months of chemotherapy, surgery, and an experimental cancer vaccine, Roger currently has no evidence of the disease. Roger has been active for many years in the Leukemia Lymphoma Society, having been its Bay Area Man of the Year in 2012. Since his diagnosis, Roger has become the Silicon Valley Advocacy Chair for the Pancreatic Cancer Action Network, PanCAN, and has joined the board of the CancerPatientLab.org, a nonprofit dedicated to evidence-based therapies. Roger also hosts www.cancerstartup.com, a platform for cancer therapy technology startups to demo their solutions. Roger has since testified to an FDA advisory committee on multi-cancer early detection and has been featured in many publications, including the Wall Street Journal on MCED. Roger believes in the patient being proactive and taking personal responsibility for their health and being very involved in their treatment decisions based on evidence-based treatments. And without further ado, let me turn you over to Roger. Thank you, Roger.
Okay, thanks very much, Paul. One correction, I don't call myself a patient anymore. As of yesterday, my doctor says I can call myself a survivor since it's been 3 years, although we'll always be looking over our shoulder. So, a cancer patient navigates the U.S. healthcare system. Why don't we call this a lawyer navigates the system? Because a lot of what I'm going to talk about, I am a lawyer, I'm not a doctor. About 1 week ago, I got a call. I get calls every week over the last couple of years, at least one a week, from patients from around the country and around the world. And they say, look, I read your article, or I saw your video, or I heard about you, and I've been diagnosed and I want to talk to you. Well, I got a call last week that was kind of interesting because it was from a doctor in Florida. And he said, look, I was just diagnosed a week ago with pancreatic cancer. I've known for less than a week. And he says, I am a doctor. I'm a pain management doctor. I spent my career treating cancer patients, including pancreatic cancer patients. I know how this disease ends, and I want to talk to you. And of course, I said, look, I'm not a doctor. I'm a lawyer. I mean, my undergrad was accounting. I have no background in this at all. He said, yeah, I know, but I'm watching your videos and I know how this goes because I'm a doctor under what we call standard of care. And I want to talk about what goes beyond that. And that was it's just a surprise to me because I've had a lot of people call me, but never a doctor calling me to ask me about this. And the reason why is because I think there's a acknowledgement out there in the community, certainly in the patient community and maybe non-medical community, that there are a lot of things that go beyond what we've all come to believe about cancer, especially stage 4 pancreatic cancer. And that's what I'm going to talk to you about here today. So let me just give you a little bit about my story before I jump into, well, I think you ought to know who I am and how I come to this space before I tell you what my opinions are on it. So this all started really in 2021. And periodically throughout my life, I've just had these bouts of stomach pain that would last a long time. And I would go to the doctor and say, hey, my stomach hurts. And they'd say, oh, you got acid reflux. And they give me some pills. Sometimes it helped, sometimes it didn't. In 2021, it did not help. This went on for about a month, maybe 6 weeks. And I called my primary care physician, several times during that time and said, look, doc, this really hurts. You got to give me something for this. And he kept saying, well, it's just acid. Take these pills. And finally, he said, look, all right, we'll let you come in and talk to somebody in gastroenterology. They'll scope you or scan you or do something. And I said, great. I said, when can we do that? And he said, in 3 months, because they're really busy. Well, I said, if that's the best I can do, okay. Well, let me tell you something. In pancreatic cancer, 3 months is a lifetime. It is the difference between life and death. But I didn't know that then. So I waited the 3 months, but the pain went away. So I didn't go. I didn't keep that appointment. Eventually, I went in and got sonogrammed, and they didn't find anything because the pancreas is very hard to capture on a sonogram. And the pain went away, and I kind of went on my way. I'm telling you that because I think that was the start of it. That was early in 2021. So in February 2022, I just went in for sort of an annual checkup, and this is sort of the flukiest thing, but I'm, getting blood drawn. And I texted a friend of mine while I was sitting in a doctor's office, and I said, "Hey, I'm at the doctor. I know you're really into health. Any blood tests you think I should ask for?" And she texted me back a big long list. And I read them off to the doctor, and I remember her saying, "I don't even know what that is, but if you want it, I'll order it." And on that list, one of them was CRP, which was high. And so I tell people that I had no symptoms at the time of my diagnosis, but I had signs. And they started in February 2022 when I got my blood test results, and some really odd things were on there. CRP is called a C-reactive protein. It's an inflammation marker generally associated with heart problems, but it could be anything in your body. And my CRP was high. At the time, I was a vegan. I exercised. I thought I was healthy. So that was weird. No explanation for that. The other odd thing is my blood sugar was high, which is how can my blood sugar be high? I mean, I think I take care of myself. Um, and the doctor said it's no big deal. It's just a little high. You're just right on the border of normal to pre-diabetic. We'll keep an eye on it. Now that I look back on it, my cholesterol had just plummeted for no reason at that point too. So it's like, just these odd things. AI would solve that problem today, but in 2022, big mystery. Why is all this happening? Doc says, look, come back in 3 months since you're such a worrier, and we'll check it again and, see what it says. That could just be, sort of a random thing. I went back in 3 months and they all got worse, all of those markers. So again, my primary care physician said, yeah, it's worse, but it's only a little bit worse. And, there's not much we can do about it. Just eat right and exercise and etc. So signs, but no symptoms, we'll say. And I didn't really think about it again. I didn't think about it again until June, July of 2022. So I tell the story a lot, and I'm not going to spend a lot of time on this, but I happen to be reading a book, sitting on a plane in April of 2022. I read about the Gallery test by Grail. It's a blood test that tests for 50 different cancers just through a simple blood test. And I had no clue that I was at risk, but I thought, yeah, I ought to take that just because it's so easy. Why not? It's expensive. It's $1,000. It's not covered by insurance. It's not an FDA approved test. So I took me, and plus you have to get a doctor to recommend it. And that was a little bit of a problem because my doctor didn't want to do it. In fact, just refused. In fact, two doctors just refused. They said, look, that's unnecessary testing. You don't have any symptoms. We're not going to waste your money on it. So eventually I did get a telemedicine doctor. I don't know, he was in Bangladesh or someplace, who knows? I never even met him, who ordered the test for me. Um, and, big surprise, big surprise. So at the end of June 2022, there are some days in your life that you remember forever. And I remember that day because I was driving to work and I had and I got a message. Yeah, the Gallery oncologist would like to talk to you live. And I thought, well, that's odd. You'd think they could just, email me the results because clearly there's nothing wrong with me. And I was driving along and I was about to log on to the call. And I remember my Apple podcast, was playing the song by Johnny Cash. The lyrics were, sooner or later, God's going to cut you down. And I remember that because I remember thinking, Well, that's kind of a dark song, especially right before I'm going to talk to an oncologist. I hope that's not an omen. Well, maybe it was, because the Gallery test came back and they said, look, we found a signal. In fact, we found a couple of them. We found a signal for cancer in your blood. Doesn't mean you have cancer, just means there's a signal and you need to get further testing. And they said, and we can tell you which organ it is as well. And I said to him, I said, well, please don't say pancreatic, because I've known people who have had that. My dad had that, and I know how that ends. And he says, well, unfortunately, that's what it is. So I was concerned, you might say. In fact, I was alarmed. So I went in, so again, I contacted my doctors, and it's at that point, everybody's still a little cavalier because the test is unproven. And it was sort of like, well, we'll get you in for a CT whenever we can. And again, and people tell me I'm fortunate that I'm in a position that I'm able to do this, and I agree, I am. I don't deny that. And right down the street from where I live is a private MRI place where you just walk in and they scan you. And I did that the next day, 6 a.m. the next morning. In fact, I didn't let any grass grow under my feet after that. And they confirmed that there was a mass in my pancreas. After that, everything was a whirlwind, because once I got in front of some oncologists, everything changed. It was no longer one of these things, we'll wait 3 months until we can see you. It was really like a 4-alarm fire. And I had several doctors, but my primary care oncologist is at Stanford Health. I went in within a week for a CT scan. They did a biopsy. They diagnosed it as stage 2 distal tail pancreatic cancer. They gave me a 24% chance of living 5 years after that, assuming, by the way, that they could do a successful surgery, which was by no means assured. They thought they could. It was what they call borderline resectable. I started chemotherapy in July 22. It's interesting. They have to put a port in you to do chemotherapy. I remember when I went in to get the port, since this is a lawyer group, I'll tell you that anecdotally, they said, well, we're going to give you this general anesthesia. And I said, oh, no, I can't have that. Just give me some Novocaine or something, but you can't put me under. And they said, only about 1% of the people turn down the anesthesia for this procedure. And I said, that's me. And they said, that 1% is always a lawyer who's got to get back to their office and bill hours. Is that you too? And I said, yeah, guilty, and I did. They did the port and I went back to work. I guess I wasn't really taking it as seriously as I probably should have. We did 3 months of surgery, or 3 months of chemo. I had surgery in November 2022. I remember after the surgery, the oncologist, the surgeon came into my hospital room, and he said, this was a perfect surgery. Those were his words. Everything went well. I got clear margins. We think we got the whole thing. He said, I would say that in this battle of Roger versus cancer, I would say that you are winning. Remember those words, you are winning. And I was winning until I wasn't. And when I wasn't is when I got the pathology report. So what they do is they take the tumor tissue, they send it to a scientist or a lab, they freeze it, they slice it, they look at it. And the pathology report was about as bad as they get. It was a really, really ugly tumor that they cut out of me. In fact, they said the chemo that I suffered through for 3 months. And by the way, chemo is suffering. I used to tell people, if you were an evil demon trying to devise a torture, you'd be hard pressed to come up with something worse than cancer and chemo together, because it throws everything at you. And they did give me a long list of side effects that I might have. And I did have all of them because they were very aggressive with the chemo. And like a lot of cancer patients, I kind of downplayed how bad it was because I didn't want them to give me less treatment than I could get. So I'd walk in and, the doctor would say, how you feeling? I say, I feel fine. He says, nausea's not bothering you? And I said, what's a little nausea? Just bring it on, crank it up, bring it on. And they did. In fact, they only stopped. They give you maximum tolerable dose of chemo. Most therapies in medicine is minimum effective dose. With chemotherapy, it's maximum tolerable dose. And it turns out I can tolerate quite a lot. So I had a lot of side effects. And it was really disappointing to find out in November of 2022 that the first 3 months of my chemo was a lot of suffering for nothing. It did not, according to the pathology report, didn't help. So the oncologist said to me, look, here's the deal. We can either continue with the chemo that you're getting. It's called 5FU, which I used to joke stands for 5 feet under, which is not a funny joke, I know. But 5FU, we can do that, or we can switch to another kind of chemo, Gemzar. And I said, well, let me ask you, doc, how long does this chemo typically work before it stops working? He says 3-4 months. I said, okay, I've been on it 3-4 months. The pathology report says it's not working. Isn't it possible that it worked for a little bit and then stopped? He says, that's possible. And I said, well, if that's the case, then it seems we ought to switch to something else. He said, maybe I'll ask my tumor board. I said, well, I don't know if I get a vote on your tumor board, but based on that, I think I want to try something else. Now, the reason that's significant is that my surgeon called me up right after my surgery. I was actually out on my mountain bike. I was supposed to be in bed. So I thought he was somehow figured it out, was calling to yell at me, but he actually called to tell me, he says, look, don't switch chemo. He said, I saw the tumor and I don't believe the pathology report. I believe what I saw and I think it did work. So now I got like these competing opinions, right? And it is up to the patient ultimately. That's kind of lesson number one out of this. The patient really has to decide ultimately what you're going to do. The doctors will have strong opinions, but I talked to 4 doctors and got 5 different opinions on when to start chemo, when to end it, what type to take, when to have surgery. Should I do it 3 months in, 6 months in, or right away? I got all of those opinions. By the way, on that, there were competing theories. Some doctors said take 4 months of chemo and 2 months surgery, then another 2 months of chemo. Other doctors said just the opposite, take 2 months of chemo, surgery, then 4 months of another kind of chemo. What I ended up doing was what lawyers do really well. I compromised. And I said, you know what, I'm not going to do any of that. I'm going to do 3 months of chemo, surgery, and then chemo. And I don't know if that was the right call or not, but it just seemed to me to be the best way to hedge the risk. Because if you get it wrong, the tumor grows and then it can't be removed surgically, right? But if you do the surgery too early, the data says you get a little worse result than if you'd have chemo first. So it's all so much guesswork. And, I like to tell people that being a lawyer kind of prepared me in a way for this that I'm not sure other professions could, because we are in the business of risk, of evaluating. Think about it. We evaluate risk. We weigh competing expert opinions. I'm a startup lawyer, so people lie to me every day, right? So we can spot bullshit. And finally, we negotiate. And I had to do all that throughout all of this. And that's how my care plan came together. And of course, all under the guidance of a doctor. And usually where we'd end up, they'd say, well, okay, that's not unreasonable. It's not what I would do, but it's not unreasonable. And that was good enough for me. Okay. So we talked about the pathology report. I don't really want to relive that. I will say, though, that after, like everything changed, by the way, after I got that report. Before the report, my oncologist, he said, you're potentially curable. Yeah, it's a 20% chance, but it's still potentially curable. After the report is like, well, let's just see how bad it is. Let's see how long it is before we put you back on something. So it was pretty terrifying. But everything stayed, what they call NED, no evidence of disease, until summer of 2023, because I was getting scanned every 3 months, and all of a sudden this stuff pops up in my lung. That was concerning. But it turns out that, next scan came along 3 months later, and I was expecting, because that's where pancreatic cancer will sometimes go to your lungs. And 3 months later, they were gone, so go figure. Okay, now I want to tell you a little bit more about what I've done, just because this sort of informs what I think everybody ought to be doing. I was at a center of excellence in terms of cancer care. So we were able to do mutation panels, some genetic testing, some next generation testing to figure out what the mutations were. That theoretically anyway is super important. And the reason why is because there might be a mutation that qualifies for a targeted therapy, unlike chemo. The thing about chemo is chemo kills everything, right? And if you get enough of it, it'll kill the patient too. So the idea is, kill the cancer, not the patient. Targeted therapies, on the other hand, even though they will have side effects usually or toxicities, the idea is that they very specifically will kill a cell that has a particular mutation. So as it turns out, I did have an ELK mutation. There's a targeted therapy for that. The doctor recommended that I take it. I turned that down. By the way, I turned down about half the stuff that the doctors suggested I take in terms of therapies, drugs, chemos, etc. I'll tell you why later. But that one I turned down because I knew from talking to enough doctors, it was hard to figure this out. And for me reading NIH papers that there is some what they call cardiomyopathy from that particular targeted therapy. And I was not yet willing to trade, heart failure for cancer. So, but nevertheless, if things were to have progressed, I gladly would have taken that choice. So the mutation panel is super important. Proteomics is another panel I received. This is another test, and it really tests the proteins that are expressed on the surface of the cancer cell. It tells you a lot about what's going on. That was super enlightening. I remember getting that test from the proteomics company, and I called them up and I talked to one of their scientists. And first thing I did is I took it to my oncologist and I sent it to him, and he sent me back an email. I'm not making this up. He sent me back an email that says, "What am I supposed to do with this? I don't even understand it." So then I went back to the proteomics company and I said, "Can you help us understand this?" And they said, "Yeah, tell your oncologist to look at page 4, line 21, just kind of direct them to, because it's a big, thick report." And I did that. And next conversation, and we did that in person, and he said, "Oh, now I get it." So that's another example where the patient really does have to be the quarterback in this game. I did several other tests. Liquid biopsy is one. There's a company, there's several kinds. I did a ctDNA liquid biopsy every 6 months. And because generally it is believed that a cancer cell will show up in your blood before it shows up on a scan. I mean, it basically has to be about a 1 centimeter mass before the scans will pick it up. But the blood, once you identify the mutations, they'll look for circulating tumor DNA or sometimes cell-free DNA. It's basically the DNA from the dead cancer cells floating throughout your blood, and it'll tell you if it's there or not. So that's something I do every 6 months. Now, interestingly, I got this report based on tumor tissue from one of these, from all these companies. And my doctors here in the US, and by the way, every one of these reports, every one of them, proteomics, RNA analysis, DNA analysis, whatever it was, the liquid biopsies, they all had on there in big bold letters, poor prognosis, which is medical speak, and I don't have to tell you what that means. And that's okay. Well, okay, thanks. I didn't ask for your opinion, but thank you for that. But I did send that to a lot of doctors, and curiously, I did find some doctors in Asia that did not think it was such a poor prognosis. They said, "Look, we've got a hack for that. We've got some drugs for that. We've got a therapy for that, and we have some immunotherapies for that." And I'm going to talk about that in a second. Now, what are the possible things I could have done? I'm going to try and move through. I'm not going to go through all these, but let's just say there are a lot of possible therapies out there. Okay, there were a lot of things. And now at this point, we're beyond standard of care. We're beyond the standard stuff that they give you. They give pretty much every cancer patient when you come in. And there are some significant consequences to that I'll talk about. But I just want to move this along. What I did was an immunotherapy, a very particular kind of immunotherapy, a cancer vaccine, not the mRNA vaccine you've been reading about in the papers. I could not get that. Right. I talked to, all of these companies that were making it, and they would not give that to me because they're in clinical trials. It would screw up their data if they gave it to me. And there's no price that anyone could buy it for. If you know somebody, maybe, but not me. And believe me, I tried, right? I called, I talked to their scientists. In fact, for one of these companies, I found out that one of their founders was speaking at a conference in Miami, and I got on a plane and flew to Miami and confronted him and said in front of all those people, and I wasn't even invited to the conference, "You've got my vaccine. You've got my cure. Why can't I have it?" I'll tell you what he said later, but I did not get that one. Instead, I've got a peptide vaccine, a neoantigen peptide vaccine through an organization here in San Francisco called the Julie Leandro Foundation. And it's not FDA approved. It's readily available outside the US, not so much in the US. I had to do what they call a single patient protocol, which I'll talk about in a little bit. But the vaccine itself, all this data is on the slide. I won't read you the slide. It was a process. Let me say it was a process. It was 6 months to manufacture and then 6 months to administer. And did it work? I don't know. I will tell you that there were circulating tumor cells in my blood before the vaccine, and there were none in my blood after the vaccine. So maybe it was that, or maybe it was one of the other 100 things I did. Currently, again, NED, as of yesterday, NED. Actually, I didn't know today because I just met with my doctor for my 6-month scan yesterday. I didn't know if I was going to show up today and say I'm a stage 4 patient or if I'm an NED patient. So I'm glad to say I'm an NED patient. And my doctor says that I'm likely cured. But again, we're all looking over our shoulders. But I do have a stage 4 plan if anything should ever go wrong. And that's what people call me about most often. Now, let's move quickly along. Although I've used up half our time, I want to get to how something you can maybe take away from this and you can use. And I call this what I wish I had known then, because there is a fog of cancer. And one of the first things I discovered is that it's just so overwhelming, and it's outside my field, that it's hard to make decisions. It's hard to just understand all the information that's coming at you. And there's conflicting information, conflicting opinions, even from standard of care oncologists in the United States. So here's what I wish I had known then, and what I wish everybody would be prepared for when they start out. So number one, you got to take these signs seriously. Right. And and again, we didn't have artificial intelligence at the time, large language models at the time that I started this. We have them now. And I don't think there is a doctor in the world that's got a brain big enough to be able to kind of look at all of this. I don't blame any doctors for not catching this early on. I did for a long time, but I don't anymore because it could be a bunch of different things. But I think AI is really going to help. Is really going to help doctors diagnose these things when we have these sort of general signs that by themselves could be a million different things, but you put them all together and they point a little more clearly towards a smaller handful of things. So pay attention to the signs. And the first step is by making sure that we're getting the tests and get the tests, even though, my primary care doctor said, no, we're not giving you that. I went and found another primary care doctor. I eventually got the tests and I found the signs. I didn't know what to do with the signs, but I did find them. And now I'm very, very assertive about that because I know how important there are. The health factors. There's a lot of things that people are just walking. I thought I was healthy, but looking back on it, I was doing about everything you would do if you were trying to give yourself cancer. The only thing I got right was the exercise because I was exercising a lot, but I wasn't paying attention to my microbiome. Everything I was eating was processed food, so it wasn't making my microbiome happy. Turns out I had toxic mold in my environment. Took me a while to find it, by the way. and a fair amount of effort, but I did find it and eliminate it. And that's what mycotoxins are. And it was the carcinogenic kind of mold too, the kind that even our FDA will admit causes cancer. You know, I had high levels of metals in my blood. I did have pathogens. I eventually got rid of them, which is directly correlated with all sorts of gastric cancers. My visceral fat wasn't too high, but it wasn't zero, and that is a risk factor. My vitamins and minerals were way off. Once I got the blood tests, I was deficient in vitamin D, in selenium, magnesium, and I think B as well. But vitamin D is a really big one. You very often find that cancer patients have a vitamin D deficiency. Similarly, oddly enough, with magnesium and selenium. Not going to make that mistake again. And then just all the environmental stuff. I mean, we still don't know why we have a cancer epidemic in this country. I mean, is it plastics? Is it microplastics? I don't know, but I don't drink hot beverages from a plastic bottle anymore. In fact, I filter all my water. Is it metals? Is it the chemicals? Is it the hormones or the antibiotics in the meat? I don't know, but I'm not taking any chances because something out there is causing this result. Lifestyle factors. I think nutrition is just number one on this. It's number one, and that is, I'm going to talk a little bit more about that in a minute, but lifestyle factors are so important. And we are seeing now a shift in the literature in the cancer community from cancer being just one of those things that happens. All right, that's I guess we'll call it the somatic mutation theory of cancer, that if you live long enough, you get a lot of mutations and eventually one of them hits on an oncogene. Yeah, we're shifting from that to saying, well, let's move a little upstream and find out why it is those mutations happen. And I think it's what we call metabolic factors. More specifically, it's probably mitochondrial damage. Well, what are the metabolic factors? Bad nutrition. I'm going to talk very specifically about that in a minute. If you got a bad diet, I think you really, like I did, it was all processed carbs. It's all processed carbs and sugar. That'll set you up. For a lot of people, it's a lack of exercise. For some people, it may be some sort of vitamin mineral deficiency. Alcohol is a big one. For us lawyers, sleep was a big one for me. Sleep was a very low priority item. I will tell you that I've seen the literature now, I've looked at the studies. Sleep is a number one priority item for me now. So if I got a client in India that says, look, I can only talk to you at midnight, I'll say, well, then we're not going to talk because you can stay up till midnight your time to talk to me. I'm not going to, right? And, it's just one of those things that has to be non-compromisable. Same with stress. I didn't realize it, but my stress levels were off the charts. You know how I found that out, by the way? Because I had no idea. I didn't feel anything. It's when I was going through treatment, I'd be in the doctor's office and, I'd have to get like an hour or two of saline before they do the chemo. So before I started feeling bad, I'd have a good hour or two so I could take calls and I could talk to clients. And I remember being on one call and it was a negotiation of an indemnity in an M&A deal or financing with opposing counsel. And it was not acrimonious. It was, it's adversarial, of course. That's what we do. Moderately, not contentious. It was just a standard kind of back and forth. And we resolved it and we came to a compromise and I hung up. And of course, they're taking your blood pressure all the while you're in there. And they took my blood pressure before it was fine. The guy come along after I hung up the phone. He took my blood pressure and he said, dude, what happened to you? Who are you talking to? And I said, why? And he said, well, your blood pressure's through the roof. And I said, really? I mean, I don't feel any different. So stress they say it's a silent killer because you hardly even know. So I really do pay attention to stress mitigation techniques these days. And there's no doubt in my mind that there's a direct connection between stress and cancer. Cancer oftentimes comes up with people after a very stressful life event. That happens so often. In fact, it is one of the earliest things you will find in the literature. You'll find it on bark parchments. People 2,000 years ago writing about the relationship between stress and cancer. So I believe that there is a direct connection, even though your doctor will tell you, no, stress doesn't cause cancer. Well, okay, maybe not, but I think there is a correlation. The other thing I wish I'd known, I got super duper lucky. I have a really good health insurance plan, and I didn't even do it for me because I remember when I had the opportunity to check that box, I remember thinking, I've never been sick a day in my life. I'm not going to throw money away on health insurance, but I do have a daughter, and who knows, something could happen to her. She could get in an accident or something, and I want to make sure we have coverage for her. So I checked the most expensive insurance product. Oh my God. Talk about luck, because I would not have gotten into the cancer center that I got into unless I'd had good insurance. And 98% of cancer patients are insured, but there's deductibles, there's copays, there's some expense before you get there. And insurance, even though in my case I just want to say it was there for me, right? It did cover most of these expenses, not all. And I had to fight with them pretty much constantly, tooth and nail. But nevertheless, it did eventually do what the contract said it had to do. They had to be reminded of that sometimes, but it eventually did do it. But a lot of people are not so lucky. They end up going into debt. I mean, just look at the numbers. 30% of all bankruptcies are medical related. In this country, and not just this country, just around the world, you can easily go bankrupt through cancer. So when people are planning their retirement, nobody's thinking, oh, I better set aside an extra $1 million for cancer care, right? They're thinking, how much do I need to live, if I don't have medical expenses the rest of my life? And I will tell you, I've gotten to know lots and lots of cancer patients since this happened. That's kind of been my new hobby. And I have watched people stay alive until they've run out of money. And I've watched people, and I've talked to people that said, I could buy this new therapy, but then I'll have nothing to leave to my kids. And they're going to start, how are they going to pay for their education? So they got to make a decision. Do I take a chance on the therapy, or do I leave something to my kids? Those are the kinds of decisions a patient has to make. And it's better if you're just prepared for that. I think people would be retiring later if they just knew, because for me, it's a big surprise. I just assumed I've been paying insurance premiums for 40 years. They're going to cover anything I need, no matter what it is. And it did not quite work out that way. Again, insurance was there for me, but I still had I had more expenses. I'll just say I had the kind of expenses I had most people could not pay. I've just come to realize that. Yeah, on the insurance, here's the other shoe that has to drop. I do make a point of going to all the conferences now and talking to lots of people. And I did talk to some insurance industry executives because it's kind of like, why is it so hard? I mean, why do I got to fight with you guys on every claim? In fact, I had to appeal it all the way up to the regulators sometimes. And I remember the answer I got is like, well, why are you so surprised? We're a business. We're just acting in accordance with our economic incentive. But here's an interesting statistic that very few cancer patients, a lot of denials. In fact, some people say it's about half your claims will be denied. Very few people challenge them. But when they do, and this is my experience as well, most of the time, about 60% of the time, the insurance company, they say, okay, you caught me. You win. We'll pay it. If they don't, you can appeal and you might win at that point, but very few people appeal. And I can tell you why. I mean, I'm a lawyer, but just it's imposing to look at this stuff. And I remember sitting in that chemo center, that infusion center, looking around thinking, God, I got to go home now and do all this insurance paperwork. I can't imagine how these people are going to do that. I mean, some of these people can hardly walk out of here. So it's a real issue getting coverage. Another issue is the therapies, getting access to them at a reasonable cost. And Google it. This is a Medium post. I think it's Medium. It's a post by an investor in a pharma company. You can't make this stuff up. You can't make this stuff up. And that's all I'm going to say about that. I will say, well, that's not all. I'm going to say one more thing about pharma. There was a recent article in Financial Times that goes in depth into how big pharma is really, rather than developing stuff here, they're just buying it cheap in China, marketing it up by maybe 40 times, and then reselling it in Europe and the US. So just something to note, that healthcare is super expensive here and probably less expensive in Asia. I went to Asia for treatment to start, and it was about a quarter of the cost of here. The next thing we have to confront are the medical providers themselves, the big institutions. And so one of the first terms I became familiar with was called standard of care. And as a lawyer, I said, "Oh, I know, the reasonable man. You don't want me to sue you, so you're going to, stay, standard of care. I get it." Well, it is so much more significant than that. And there are standards organizations. And the way it got presented to me was almost never, "Oh, because of standard of care, we're going to give you this treatment." It was always, "That's not standard of care. I won't do it, and the insurance won't cover it, and the FDA won't approve it." So it was really a brake, more than a gas pedal for me. And it's one of the first things every patient, encounters, is standard of care treatment. And there are ways to go beyond standard of care, and we'll get to that in a second. But you just understand that the medical provider is somewhat limited because some organizations are very reluctant to do that, very risk averse. In fact, I did get an experimental vaccine, and I went to my first oncologist and I said, "What do you think of this vaccine?" And he says, "You should do that. It is your only possible cure." That's what he said. And I said, "Great." I said, "Will you give me the shots?" He said, "No, I can't do that. Sorry, my organization won't let me." I went to another university hospital, big, very well known here in the Bay Area for pancreatic cancer. Same thing. That is good science. You absolutely should do that. But I cannot administer it. My organization won't let me. I went to a third one, another big organization in San Francisco. And it's same thing. He said, "Here's what I'm going to do. I'm going to help you administer that on my own time, on nights and weekends, purely out of my own intellectual interest, because I'd like to see if we can make this work for somebody." And he says, "But I can't do it officially through my organization." And I asked, "Why the heck not? You all agree it's good science and it's my only cure." And he said, "We can't because there's just not enough money in it. It does not, I can't charge you enough to cover the risk of something going wrong." So just keep in mind that, I don't think the physicians are in this for profit motive. I do believe that there is a real aversion to risk. And let's be honest, we just have to confront this sad fact that there is a lot of medical error. And it's the system in the US, and my belief, my opinion is that it is so overwhelmed, especially in cancer, that the risk of medical error is just very, very high. I want to just mention FDA. Where do I start? The FDA, really, I view their role as the organization that decides what big pharma companies can advertise on late night TV. They certainly weren't there to help me do anything. They were there to stand in the way. That is my view. And there's only really a couple ways you deal with the FDA. One is you go to another country that doesn't have an FDA. I did that. The vaccine that I got, which is manufactured in the US, it required an application process with the FDA called expanded use or expanded access, compassionate use, which my doctor had to sign off on, which he was a little too quick to do. He is very happy to do that. And it required 6 months of testing. And I remember at the time that I signed up for the clinical research program, the doctor said, "I got to warn you," because I had to pay for it because it's not FDA approved and someone has to pay for it. So I paid for it and it was super expensive. He says, "I got to warn you, more than half the people that pay for this therapy that you're about to have manufactured will die waiting for FDA clearance." Think about that. They die before the FDA will allow it to go through their testing standards. And no one has ever been hurt by this vaccine that I got ever, in thousands of administrations. But, they got to respect the integrity of the bureaucratic process, I suppose. So I went to a foreign country where, I was able to get it within 6 weeks, and I came back and finished up in the US after it had gone through the FDA approval process. I was not going to wait around, while this thing went through testing. I'll tell you anecdotally, the other reason that I have a little bit of antipathy towards the FDA is on the day after this 6 months, the day before we're supposed to start the vaccine, I got a call from my doctor and said, I have bad news. That vaccine that you paid for and have been waiting for 6 months to get, the FDA just called and they've changed their mind. They've withdrawn their approval. I said, can they do that? He says, yeah, they can do that. And it wasn't because it's unsafe. It wasn't because it wasn't proven. It was because they had a fight with the administrator of the medication over who gets the data. So I was collateral damage in that as far as they're concerned. And I told the doc, I said, I'll tell you what, don't go destroying any of my vaccine. You don't do anything. I'm gonna come see you tomorrow. You can't legally give me that vaccine, but it's still mine. And I don't care. I'll find a junkie on Mission Street to give me the shots if I have to. I mean, what would you do? So I did show up the next day. And by that time, he said, never mind. First thing he said, before I even said hello, he said, don't worry, there's no way I'm not going to give you this therapy. Apparently the FDA did relent, but it was a pretty unpleasant experience. We have right to try also. That is not really being used very much. People would rather go through the FDA expanded use, compassionate use or expanded access process, but it is out there. I have seen some scammers use right to try to get some stuff into the market. And then there's so much alternative care. It's overwhelming, but fortunately there are organizations that will help you manage that, because cancer is such a complex set of diverse diseases. It really requires a personalized approach, and what works for one patient may not work for another. What works in a mouse may not work in a human. What works in a dish may not work in a live person. What works for one cancer cell in your body might not work for another cancer cell in your body. So it requires quite a bit of personalization, and there are organizations that will help sort that through. And then beyond standard of care, for people who want to do this, there are, like I said, foreign travel is one way that we get around FDA requirements. Another one is to go to integrative cancer centers, where they have doctors there that are willing to go beyond standard of care and do things that may not have that may be FDA approved for one disease, but not for another, but that they can try. And then, of course, clinical trials. About 4% of cancer patients get into clinical trials. I tried, I did not get in. So that's why I had to do some other things like this expanded access process. Okay, the best thing you can do, the best thing we can do when it comes to cancer is not to get cancer. All right, that's my conclusion, because I think what I did, and this is a controversial thing about everything I say is controversial, I know, but this is controversial. I think I could have prevented this disease. I think I gave it to myself. All right, and I know people don't like imposing that kind of responsibility on patients, and I'm not. I'm just saying, for me personally, I think that my lifestyle contributed to what I was doing. So let's go through some of the lifestyle factors for prevention. I have been all over the web trying to find what is the magic bullet that has caused cancer rates to skyrocket in this country. And I can't find it, but the closest correlation I've been able to find is obesity. That's where you'll find the closest correlation between cancer rates and any other factor. That's obesity. And just a couple months ago, a study came out from UCLA that says stress and obesity together is a poison. It is a poison. It is a fuel for cancer. So just word of the wise, the first thing to work on is obesity if that's your issue. Second thing is probably stress. And there are stress mitigation techniques. I'll get to that at the very end. Secondly, again, controversial, but even Shakespeare knew, right? in Henry V when he said, "I had rather live with cheese and garlic in a windmill than feed on cates." And cates was delicacies and defined, and even back then they had refined foods. So I think refined carbs is a problem because, well, don't take my word for it. Just look up this case. Just read this complaint. Martinez versus Kraft. It was brought by a diabetes patient who said that the big food companies, basically, they got him addicted to fast carbs and ultra processed foods and gave him his set of chronic diseases that most Americans suffer from. And these are the allegations in the case, that these ultra processed foods are addictive, that there was deceptive marketing to vulnerable populations, and it contributes to a lot of diseases. Uh, it is fascinating reading, but I will tell you, it looks exactly like, was it 20 or 30 years ago, the lawsuits against the big tobacco companies, kind of same theory. I'm really curious where this goes. It's been removed the federal court recently and is still in play. Started in Pennsylvania, removed the federal court, and it's still in play. But if you want to read a real horror story of, if you believe the allegations in the complaint, well, you might change your eating habits. Here's another big one: alcohol. Surgeon General 2025 advisory on alcohol and cancer risk. Finally, when I was diagnosed, the American Cancer Society website said 1 drink a day for women, 2 drinks a day for men was just fine. Well, I'm here to tell you it is not fine. And the Surgeon General has finally acknowledged that. And this is a direct quote from their report. Quote, "There is no safe level of alcohol consumption." Take a look at it at your own, but alcohol there is absolutely no reason that any cancer patient should drink at all. And that is controversial because I've run into a lot of cancer patients that don't stop drinking. I have a friend who has well, she died now, but she had pancreatic cancer. And I remember we got together and I asked her, I said, "Are you still drinking?" She says, "I have a glass of wine at lunch every day." I said, "Why? Why do you do that? You know it's bad for you." And she says, "Because wine gives me joy." I said, "Well, I didn't say this, but okay, you know what else it gives you, right?" So I know that's a hard one for people to give up. Exercise. Again, another very recent study. There are so many studies now that absolutely establish the benefits of exercise in helping not only with just advanced cancer and helping with dealing with chemo and helping with avoiding metastases, but actually acting as a preventative measure. And of course, if you listen to some of the podcasts, Found My Fitness by Rhonda Patrick, she's had entire podcasts on this exercise for cancer prevention. And she has claimed boldly that exercise causes so much damage to normal cells can withstand it, but cancer cells, they have some weaknesses, and this is a weakness. It causes so much mitochondrial damage that the cancer cells will die, the normal cells won't. I think early detection is super important. Again, I've testified to the FDA on this. I'm a believer in all of these. I think more information is better than less. The problem is the U.S. Preventative Services Task Force basically decides, well, we'll get to that in a second. Technologies, I continue to do hyperbaric oxygen. I continue to do exercise with oxygen therapy. I think all of this helps. There are new drugs. There is stuff coming along constantly, just constantly. There is stuff coming up into the market. In fact, we're going to be talking about that at the cancer conference at Stanford that I am hosting on July 17. If you're interested in the space, you'll want to come. This last one, histotropsy, I just heard about 2 weeks ago, but it's cleared the first set of clinical trials. Incredible results in clearing up liver cancer, 95% success rates, better than any drug ever has. I want to mention artificial intelligence and personalized care. This is clearly where the field is going to, is finding a machine that can look at all these signs and say, hey, you might think about this, you might think about that. And there are several projects going on around the world. These are a handful of them. We're going to see a tremendous amount of development in this space going forward. And this is one of the first things I do is I would, find a tool that can help us think through this. And the big objection to this has historically been physician resistance, because doctors don't like to Google for their answers, but that's changing. And there are tools now that even just like lawyers have Harvey now, doctors have AI systems that are helping them. Okay, I know I'm getting towards the end, so I have to move fast. So if you're listening to this, you have a 40% chance of having cancer at some point in your lifetime. Those are pretty unpleasant numbers, but a good reason to pay attention to this. Here are some stats from the American Cancer Society. That big red one is lung cancer. It went up and it's gone down as people stop smoking. In my case, mine is the pancreatic cancer. That's the blue line. You'll notice that one continues to go up and up and up and up. Okay, and we're trying to figure out why that is. One way to figure out why that is to fund research. And if you've been reading the papers, you see what's going on. And government is cutting these problems. There's proposed cuts to NIH funding, a 40% reduction in the agency's budget. I can introduce you to people whose research programs just evaporated. They just stopped. That's it. That's the end. We're halfway through. Just this week, I sat down with somebody who's got a very compelling therapy for childhood glioblastoma, one of the deadliest things you can think of. Usually, once a child gets a glioblastoma, they're gone in 3 months. They've got a target. They have a druggable target, and their funding came to an abrupt halt because of this cut. So I don't know who it is in Congress that hates kids that much, but this is someplace. I do not think that cancer research is fraud, waste, or abuse. I think this is the kind of thing government should fund. And if you agree, just go to one of these links that I've got, www.fightcancer.org or pancan.org is very good at advocacy, and write your senator. I write my senators constantly. They all know my name, and my congressman, trust me, because I'm constantly bugging them about this. And by the way, the National Institute of Health is the one that I had mentioned most clearly because they're the largest biomedical research agency in the world, and they invest the most. That 40% cut of budget. It's kind of hard to believe. Big attack on fundamental research. It's and we do have a problem. You know, the U.S. Preventative Services Task Force decides which diagnostics get approved. They recommend to the FDA which diagnostics should be approved. And they've taken a very conservative approach. And these are some clips from my personal correspondence with the U.S. Preventative Services Task Force because they recommend against pancreatic cancer screening. Okay. And it's based on just completely erroneous assumptions. So that's what happens, I guess, when you get a panel of, well, I'll leave that. Let's just say I disagree with their assumptions. And this has most recently gotten a lot of press because they recommend against prostate cancer testing for anyone over 70. Well, do we know of anyone over 70 who did not get this very simple blood test based on this recommendation? And it turns out he had stage 4 prostate cancer. I think that what happened is I think Joe Biden's, well, I don't know, but I can totally see a doctor telling even a president that, look, screening guidelines say that we shouldn't give this to you. So I'm not going to. And just think of what a difference that might have made. Let's move along. So I want to close with some organizations that I think you might want to be concerned that I'm involved in, and I think you want to look at. Cancer Patient Lab. We go beyond standard of care for very engaged. We believe engaged patients get better outcomes. My own group, cancerstartup.com. Government is not funding cancer research anymore. Big pharma can't because it's too risky. That leaves startups. Those are my people. And they're all, as many as I can gather are on cancerstartup.com. And like I say, we are having a big conference at Stanford on July 17. Unfortunately, we're out of time. I'm not going to be able to talk about the scams and the fraud because there are plenty of them out there. I even fell for one, and I thought I had, a better BS detector than that. Resources, they're in the materials, places you can find. Books, this is what I read when I was going through my illness, and they helped me tremendously. Different things resonate differently with other people. I mean, my daughter recommended Krishnamurti to me to deal with fear. I know about Yalom from dealing with fear of death. I know about John Kabat-Zinn from dealing with pain. And I'm just saying that sometimes you can find real answers out there if you look. Okay, I'm sorry, I'm a little over 1 minute over time and I had to rush to the last, but I'll stick around if people had questions. So let me take a look. Holy cow. Okay, let's see. Was a private MRI expensive? Full body is $2,500. If it's just abdomen, I think it's about $1,500. So yeah, it's expensive. Question about vitamin D, is it based on the recommended dietary allowance? No, I think that's not enough. I think you need to what I do is I get blood tests to make sure it's above a level of 70, which some people will say is too high, but I want to stay on the high end of that. I think the recommendations are that you be somewhere 20 to 40 or something like that. What foreign country did you go to for your vaccine? Japan. I went to Japan, and it was incredible because I talked to a lot of companies, cancer therapy tech companies here in the Valley, and they'd show me stuff. And I'd say, that's incredible. I said, that ought to be in the market. That ought to be available to everybody. When can I get that? And I remember in one case, the guy said, oh, 10, 15 years, we should get FDA approval. And I said, well, I don't have 10, 15 years. If I want it now, what do I do? He says, oh, it's easy. You go to Japan, or go to, a lot of countries. But Japan was just so far ahead. And it's not, I mean, they have good doctors, but it's not that they have better doctors. It's they have a regulatory system that gets this stuff into the market much more quickly. Which Asian countries allow this? Well, China's probably number one, but for me, it was Japan. I just, and the reason why is because I talked to the doctor there, and they're in Germany. They're doing this experimental vaccine. It's not even experimental anymore. It's all over the world, the industrialized world. But I really liked the doctor in Japan, in Tokyo. I just had a sense that he was very committed to saving my life. And so I went with, and plus he was published. He had his own lab. He had been doing this for 15 years. So I had a good feeling about that. And I interviewed a lot, trust me. By the way, that's how I picked my surgeon too. I went with my gut. I just went with the guy that I felt was who would be most offended if I died. That's who I picked. Okay, NHS in the UK just authorized the blood test. If you're talking about the Grail Gallery test, that is news to me because I thought they had not, but that's great if they did. Please send the information regarding the conference on July 17th. I would be happy to do that. It is at the Stanford Faculty Club. It's being advertised on Eventbrite. It is the 2025 Silicon Valley Cancer Technology Conference. Yes, I will circulate the full set of slides. I actually changed them this morning. All right. Do you have an opinion about ivermectin and fenben? Oh boy, I wish I hadn't taken that question. That is very controversial. And first of all, I will tell you that I did try it for a little bit, and it's very controversial. And in fact, some of the discussion groups won't even let you mention it. I would say that I just don't know. And that's most of these therapies, I just don't know. I stopped taking it and I would not take it again because there's been a recent study that came out that shows that ivermectin really hits your immune system. And my view of this is that, my goal here, I want to feed my gut, protect my liver, and strengthen my immune system. That's the recipe for avoiding cancer. So I'm not going to do anything, not even chemo. I'm not doing anything that's going to hit my immune system. But the answer is I don't know. I just know it's controversial. U.S. healthcare is the worst in developed countries. Okay, let's see if there's any questions that end with a question mark. Amount of time you spent researching your care options, finding providers, getting second, third opinions, fighting insurance companies, advocacy. A tremendous amount of time, a tremendous amount of time. I did it every night and every weekend, and I mean all weekend. I was reading NIH papers. In fact, like I said, I had my last meeting with my doctor yesterday, and he started the meeting saying the same thing he says to me every time. He says, "Are you still working?" And every time I say, "Of course I am. Why do you ask?" And he says, "Oh, no reason, you know." And I always thought it's because he was really pessimistic about my prospects. But yesterday I just asked him, I said, "Why do you ask me that every time I talk to you?" And he says, because it seems to me that you're a full-time cancer researcher. Like every time I talk to you, you're telling me about the six latest things. He says, "So I'm just wondering if you're spending full time just researching cancer." And I got to tell you, for 2 years, it felt like that. It is just a tremendous amount of work. Now, the good news is there are cancer patient advocates out there that will do this work for you and understand this stuff that you can rely on. See, I didn't know that at the start, so I was out trying to figure it out for myself. Okay, yeah, I understand that. Yeah, some of these tests are, yeah, these tests all have false positives, false negatives. Nothing's perfect, but I still want the data. Okay, my body, I want to know. All right, and I don't care if there is a chance that it might be wrong. I don't care. I want to know. How much you spent out of pocket on your care to date, including travel? Oh, I don't know, $500,000 probably. I'm afraid to look. Um, I just started my own practice and found insurance and covered California. Any recommendations? Yeah, the information is overwhelming. I will tell you that you might check out an organization called Triage Cancer because their whole thing is addressing the financial toxicity of cancer, and they know quite a lot about insurance and can answer your questions about insurance. Have my blood test markers like A1C return to normal range? Yes, in fact, they have. In fact, my A1C is now 5.2, which is where it was 5 years ago before all this started. And by the way, after my surgery, it went up to six something. I was pre-diabetic. And my doctor said, "Well, that's what happens after you get pancreatic cancer. You're just going to have to live with that for the rest of your life." And that was incorrect because after I went low carb and I've got a system. Let me put it that way. I wear a glucose monitor. I walk after meals. I time my meals. I do everything, and it's back down to 5.2. But it takes a little work now. Let me put it that way. And the other markers are, oddly enough, I'm healthier now than I probably have ever been. I know that sounds weird. It's weird that the cancer patient should be healthy. Did you ever receive access to mental health resource therapy? Well, let me address that. And I'm a little different. Like I'm kind of I'm kind of a do-it-yourselfer. So I went to the books that I mentioned. Um, but there was a point when I was just like super angry all the time. And if, for example, it seemed like appointments would get missed, stuff didn't get scheduled. I'd show up for chemo treatment, like, "Oh, we don't have room for you today." I mean, stuff was happening that I didn't think was happening. And I was just super duper angry, and it was causing my stress to go off the charts. And it occurred to me that there's got to be something wrong with my perception. The system cannot possibly be this screwed up. It cannot possibly be where I got to fight with every insurance claim, that they would forget to schedule my surgery, which actually happened, that some gatekeeper, that they won't give me my tissue from the pathology lab when that's my only chance. There's something wrong with my perception. The world cannot be like that. And so I did get a therapist. And I found somebody who does cognitive behavioral therapy because I didn't want to lie on a couch and complain about my problems. Give me some tools, to reframe and understand what's really going on, to see reality as it is. And I'm not sure who converted who in that process, me or the therapist, but she did give me some reframing to, at least it didn't feel like people were trying to kill me. And that's what my doctor even told me. He said, "Look, nobody's conspiring to kill you." He even told me that once. So I did get those tools. And I'm a big believer in cognitive behavioral therapy. But at the end of that, after I all became kind of clear that, oh, this is just the system being overloaded. This is not people that hate me. It's just overloaded. the therapist did say, okay, well, now I'd like to deal with your depression. And I said, well, I'm not depressed. And she said, well, of course you're depressed. You've got a terminal illness, and and so you're depressed. I said, no, I'm not depressed. She said, well, I think that's just what a depressed person would say. And I said, well, you got me there, but that was the last conversation I had with that therapist. In fact, during that time, I remember I had that conversation with my daughter, and but it was a little different. She said, I don't understand why you're not depressed. She says, you are the happiest. And this is right in the middle of chemo. I had no hair and I was scrawny and I had this nausea. I had to carry a barf bag with me. She says, you're the happiest person I know, and I don't understand it. You should be the most depressed. So go figure. I don't understand it either. Um, I'm sorry. So have an actual colonoscopy, not rely on Cologuard. Yeah, trust me, I do. I get tested. And do you recommend a vegan diet like the one you're on, or a high animal protein diet? I think everybody's different. The vegan diet I was on, I did it the exact wrong way. And I know the studies say that a whole food vegan diet's good for you, but a carnivore diet can be good for you. So the thing they're both missing is that processed, ultra processed food component. And I did it all wrong. I was on a vegan diet, but in order to get enough calories, because I was exercising a lot, I was just living on sugar and fast carbs and, energy bars and sodas. I mean, just fast carbs. And it's just the super worst thing I think anyone could do, even an athlete. Okay, I see I'm way over time and I've gotten through all the questions. I want to thank you all for your attention. I hope you got something useful out of this.
We just want to thank Roger for his presentation. It was very enlightening. It was enjoyed by all. I wanted to also remind everybody that Health and Wellness Committee does a walking challenge that starts on June 21st. If you go to our website, you can sign up, you can join teams, and we're going to walk virtually through Italy this summer. So please join us for a little exercise. Thank you again, Dr. Oh, I didn't realize I was muted there for all that time. Thank you, everyone.